We'll move straight on to our next presenter, who is Ruurd Jorritsma from Utrecht University in the Netherlands. Thank you very much.
Thank you for the introduction. I wonder if I can also tell you a fairy tale, but I think I stick to a more boring. Sorry, doesn't work?
Yeah, it wasn't working for us, so the tech guy was doing it.
Okay. I wonder what happens now. So I have to raise hands. Is that the question?
Yeah, I would do that.
Okay. I'm telling you, giving you a presentation on a randomized clinical trial on digital dermatitis. Just to give you an indication on what we did, and then I would like to have the next slide up, please.
Just wave your hand, I would think.
To who?
It should be that box there.
Already working. We did this as part of a registration study for a product that was similar to what you saw in the previous presentation. That was a gel. We used more or less the same product, but now as a spray, and it was a registration study for Intercare. And then I think it's always nice to have a clear statement on what we did and what the commercial party and company did in this way. The sponsors, so to say, did a selection of the farms and also contacted the claw trimmers. And we as a university did the design of the study, and we also decided which cows or which legs, I would say, were included in the study. And we did also the scoring, and we were responsible for the analysis. Really, the registration of this product was really important in the Netherlands in particular, because I think you've heard about the struggle, particularly in our country, but also in others, that there is a problem or a debate on the use of antibiotics. And this is really a product without antibiotics, so that could be a very good alternative for the antibiotic use that is currently used all over the place. The lesions are already presented by several speakers before, so I'm not very much running into that. The only thing I want to say here is that we included cows, all cows, with the M2 lesions. Another slide that you already saw by previous speakers, I think. Digital dermatitis is causing a lot of lameness, is highly prevalent on farms, sometimes up to 83%. And the prevention is made by food baths or hygiene, or a combination of them. And we'll focus, or I will focus today, on the treatment of individual animals. Part of the total plan probably to get rid of the disease, but at least part of the total plan, and that's also, I think, worth studying. The focus of the project was really on the treatment of M2 lesions. So we're looking here now at this stage of the disease rather than at anything else. And although I know, like you have seen before, that there is a lot of interactions between the several stages, we were only interested in whether or not we could get rid of these M2 lesions. So everything else was good enough for us. Maybe that's not good for the long term, but for the short term, I think that's a very good goal, good objective of a study. For the registration of a product, you always need to compare that with an existing product that is already on the market. And the registration authorities then ask you to do a calculation and a study that is directed at non-inferiority at the product that is already on the market. We decided to do that with a registered product which is very commonly used in our country, in the Netherlands, which is chlortetracycline spray. And we decided that we would like to have a significant difference on that product, and that's also still non-inferiority according to the legislation, if it's more or less the same. And more or less the same means even 10% less cure would be more or less the same. As the C2C spray is more or less having a cure rate of around 60%, it means that our product would have the label of non-inferiority if it has a 50% cure or higher. To do the calculation of the sample size, we needed, of course, that information, so the amount of cure that we could expect. And on the other hand, we did this on farms, so that means that you also need to deal with interactions between cattle on the farm. And that's a really difficult task to do because nobody's looked at it. And because there is because there is lack of information on the interaction between animals, we decided to choose for a very short follow-up period to get rid of all the interaction that might occur between cows that were treated, or were not treated, or were getting ill, or were already recovering. So that's the reason why I choose the very short follow-up period. This is more or less like the sequence of events that occurred during the trial. We followed the Consort, or the adjusted Consort reflect statement. We had 9 herds that we included in the first place, and then we ended up with 7 because some of the herds didn't have a very high number of cows with DD lesions. And for us, that was not a very convenient thing to do because then we needed to go more frequently out of the farm. So we ended up with, in total, with 7 herds, and we found 762 animals to be included. On those 7 herds, we trimmed all the animals that were on the farm at that time, and we included all the animals with M2 lesions in the study. So we treated all the M2 lesions on these 7 farms. In total, we included 285 legs with the M2 lesions. And of course, then we divided them among the 2 treatment groups. I already told you about that. We had the product, the new product without antibiotic, which contains copper sulfate in the spray form, and we had the control treatment with tetracycline. This is more or less the design of the study in the remainder. So we ended up with 114 cows treated with our new product and 117 with the control one. That means that we lost halfway some of the cattle or some of the animals, it looks like, but that's due to the fact that we had some animals with more than 1 lesions. And we randomly selected one of the legs to be included in the trial. Which was, then it's up to the treatment that we implemented. The treatment was, and I think that's very important, also when you look at the results of the previous speaker, we applied the results as they were on the label. And I think that's important because many times the drugs aren't used as such. And you could deliberately choose for one another or without or with bandage if you like. But I think at the long end, we as clinicians need to take the label for granted and use the products that are labeled as they are. Which means that we used different treatment techniques, as you could say. For our new product, we sprayed them at day 3. We dried that and we covered it with some wool and an elastic bandage with some vet wrap. And at day 3 and 7, we repeated it, but at that time, at those 2 days, we didn't apply any vet wrap. We scored all the animals at day 10. And again, I already explained to you why we didn't wait for another week or 2, because we would like to get rid of all the interactions between the animals. For the control product, we only sprayed them at day 0, 1, and 2, and we sprayed them twice for 3 seconds, according to label, with a drying interval of 30 seconds. So there is a pretty different treatment strategy between the 2 products, I think. We analyzed it with logistic regression, and we used fixed effect for herd and for treatment. And out of the logistic regression, you get an odds ratio, but we recalculated for just for sake of interpretation to relative risk values. These are the results of the 2 groups at day 10, so the end of the trial. So all the M2 lesions that we had at the beginning were either remaining as M2 lesions or went into M1, 2, 3, whatever there is in the classification. And I think you see that most of our treated cows changed into another category when we used our new product into M3. Whereas for the other, our comparison product, many animals, many legs, I should say, stayed in the M2 stage. To have a look at the results on the herd level, these are the results on herd level. And the 2 bars represent the 2 treatment strategies. So we had the black bars with the control treatment and the more gray bars with the new product. And you see that there is a consistent higher absolute difference between the 2 products in all farms. So they're consistently better off on the farms with the new product with copper sulfate spray. Overall, taking into account the fixed effects of Ruurd, for example, we had an odds ratio of 8.2 for the new product compared with the C2C spray, with an estimated relative risk of 1.9, and that was significantly as well. So to go back for the interpretation of the results for the sake of non-inferiority, I showed you here a graph of the things that were happening. These are the farms, and every dot represents the average on the farm and the estimated range of the odds ratio that would be present on the farm. And the very low one is the overall estimation of our product. So as this is a comparison between the control product and the new one, this means that the 0 or even the little bit lower treatment effect would be still acceptable as non-inferiority. So if you have the cutoff definition of that, which is actually the case when you are looking for non-inferiority, all the estimations on the right-hand side would be in favor of the new product, whereas on the left-hand side there would be inferiority there. So this would be non-inferiority, this would be inferior. And I think it's pretty clear that in all the farms we were in the green area, and also in particular on the overall estimation of the trial. This would be the inconclusive one, so that's clearly not what we had. But let's have a look to be let's be a little bit more precise here, because maybe the non-inferiority is not that ambitious for you. And therefore we set up the red dotted line in which we clearly see that there is a benefit of the new product compared to the control one. And if that is the case, and I think that's overall the case if you look at the bottom end of the slide. Oh, sorry. At the bottom end of the slide here, that the new product is really doing a better job, and I think we can say that it's superior to the other one. Taking into account, of course, how we use the product. So the conclusion or general discussion, I think we had a greater clinical cure in all the farms, absolutely clinical cure in all the farms for our new product. We had an estimated or an odds ratio of 8.2. The estimated relative risk was also pretty high, 1.9. And the downside or the discussion part of the study is probably about what about the follow-up period, and do we need to take into account the difference between the label instructions. And with that, I would like to thank you for your attention. I'm happy to entertain any questions.
Great, thanks, Ruurd. I'd particularly like to commend the estimation of the relative risk, because that is such an easier thing for us as clinicians to interpret. I'm going to go over to that block over there, who are not in my line. Are there any questions from that block? Yes, there's a question.
Ben Holtzau from Dutch Animal Health Service. Thank you, Ruurd, for your presentation. I might have missed it, but have you looked at differences in parity and days in milk in different groups?
No, we did not, but I think it's not very much required also. It, of course, from a scientific point of view, it's a very interesting question to ask. But in this case, we randomized the treatments over all animals that were presented to us. So we flipped the coin in the first animal and then applied alternatively the 2 products to all the animals. So in that case, we randomized also lactations, productions, etc. over the 2 groups, I think.
Okay, thank you. And a final question.
Juan Manuel Ariza from France. There is a high recurrence of the lesions after 4 weeks. Why not prolong the follow-up period?
Yeah, thank you for the question. I think this is this is something that I tried to address also in the presentation already. That you could think about the recurrence or the relapse of cases in the long term. And I think that's very much dependent on other things only than the treatment that you're applying. And if you would really like to do that, I think you also need to standardize all the environmental issues that are present on the farm, and particularly if you have both treatment and cases and controls on the same farm, so they probably interact with each other. So I think it's a very interesting thing to know, but for the sake of this trial, I think it's very difficult to have a clear-cut answer for on that one.
Great, thank you very much indeed.